Hello everyone, it's Dr. Steinweg. I wanted to talk today a little bit about what you should do after a tooth's extracted. Now, just starting off with a little disclaimer here, some dentists will have their own post-operative instructions that they want to give you. What I'm about to tell you about is something that just works really well for me and my patients. So after having a tooth extracted, there's some simple post-operative instructions that you should follow. By following these instructions, you'll be comfortable and have no complication. First step is going to be, you leave the office with a piece of gauze. You're going to bite on this gauze until you get to your house. Once you get home, you can take out the gauze and examine it. If the gauze has a little bit of blood on it, that's okay. If the gauze is completely soaked through, place a new piece of gauze for 10 minutes. After the 10 minutes, if you take the piece of gauze out and it has just a little bit of blood on it, go ahead and leave the gauze out for the rest of the day. The idea behind this is if you take the gauze out and it only has a small amount of blood on it after 10 minutes, it's most likely not actively bleeding and you won't need to continue to hold pressure. Sometimes holding the gauze in for too long can actually disturb the extraction site. When you arrive home, use an ice pack and hold the ice pack on the side that was worked on for 20 minutes. Then remove the ice pack for 10 minutes and then replace the ice pack for another 20 minutes. Some of you might be wondering, can I eat after a tooth extraction? And the answer is yes. Once you've held pressure on the spot and you've made sure that there's no bleeding anymore based on what we already talked about with the gauze, feel free to have soft food. We want to avoid crunchy foods on the side where the tooth was extracted. Some harder foods can be had on the other side of the mouth, but we want to make sure that we don't actually contact the extraction site with anything hard or crunchy. Nuts, chips, things like that. Also avoid alcoholic beverages and smoking for the first 3 to 4 days. On the day of the tooth extraction, it's important that you brush your teeth that night. After brushing, rinse very gently with just water. Other than the light rinse after brushing, we don't want to rinse our mouth with anything for the first day. The following day, we advise that you use a little bit of warm salt water to gently rinse the area. Don't spit hard into the sink. Saltwater rinses should be done about 2 to 3 times a day for the first 4 to 5 days to help with healing. Now, on average, patients will explain to me that the pain level after a tooth is extracted is around a 2 or 3 out of 10, 10 being the most pain you could ever imagine and a 0 being no pain at all. So pretty low on the spectrum. The discomfort that does exist after a tooth is extracted can most often be managed with over-the-counter pain medications. Now, if myself or whoever's working on you anticipates you might have slightly higher pain after a tooth is extracted, we'll make sure to prescribe you the proper thing. Now, if myself or the dentist performing the procedure thinks that you'll need more pain medication, they'll certainly prescribe it for you. Coming to the dentist's office for procedures like tooth extractions can lead to a lot of anticipation of pain. And we just want you to know that you'll be able to stay comfortable without taking a high-strength pain medication. Vast majority of the time, over-the-counter pain medications will work perfectly fine. We'll have close follow-ups with you as needed after the procedure to make sure that you're comfortable. Lastly, take all medications prescribed by the dentist. Antibiotics aren't needed as often as you think following tooth extraction. We'll typically prescribe antibiotics if we suspect that there's infection or if we have an individual that's more prone to infections due to medical history. So if you have questions, please mention it at a consultation or give our office a call.